Zuccon, and I'm the lead for the AI program here at QDEC. And these are the people involved in the AI program at QDEC. You will hear from most of them. Today, you will not hear from Sebastiano, but I will cover his work later in the next session. So I've been asked to tell you my background in terms of roles in education. My background is up there, but really what I want to stress is that fundamentally I am an AI researcher, but a lot of my research plays in the area of health and attempts to address a spectrum of challenges that we face in healthcare, from challenges in the consumer space to challenges in the medical researcher space to challenges in the system space. So how I would like to spend my 5 minutes is to tell you about 3 examples of my previous research and current research to make you understand the type of things I do. And it was great to hear the keynote this morning and the panel flagging some of these challenges that actually my research attempts to address. So the first work I want to highlight is some work we have done in the past in the consumer health space, in particular devising technology that help consumer access health information at the right time and in the right way. And we particularly looked at a technology that is called health cards. If you have searched Google or Bing or Baidu for health information, you would have seen this type of cards on the right-hand side, or nowadays even in front and center of the interface. They try to give you some information about the condition and how to treat it and so on. So we have collaborated a lot with Google in this space, and we have looked at how these health cards affect search behavior and affect decision-making from consumers. And we have done this using a range of techniques. We used eye tracking to see where people are putting attention. We have used log analysis data to see what they're clicking and so on. And we use user study methodology to see the biases that were emerging from their decisions. And that led to some recommendations that were made on way to improve these health cards, and Google actually have taken up on these, and they've changed their health cards following our research. And we also have devised effective methods, AI-based methods, to find the right health cards, or the subset of correct health cards, to show to consumers, to lead them to better understanding and interpretation of what they are experiencing, the data they are bringing on and they are using to search the search engine. So that was past work, and now that has evolved with the evolution of technology. So we are now looking at how health consumers are using generative AI technology like ChatGPT, and what affords us that technology are now providing users, but also what are the pitfalls and the perils of using this technology. And at the same time, we are also devising generative AI technology that help reducing hallucinations. So these factual errors that however look very good and credible and that people end up trusting, or technology that allow the language model to correctly attribute the answer that they are giving to the underlying information that could demonstrate that answer, could support that answer. And of course, we are also working on compliance of this language model to policies that service providers will want to enforce, and also enhance the scrutability of these models in terms of why they generated certain answers. Another area I want to highlight is work that we are doing to help practitioners with making clinical decisions. And so, base their practice on evidence. And at the same time, the same research also plays up in the policy-making area, because you want policy derived from evidence. So with that respect, systematic reviews are a key tool for decision makers to make policies and for practitioners to make decisions about different aspects of health treatments. But these systematic reviews are very costly, they are time-consuming, and when they are published, often they are out of date. They cannot keep up with the sheer amount of research that is being published out there. And so our goal has been to develop AI technology that can accelerate the creation of these systematic reviews, and also that can lower the costs so that we can do more of these reviews. The method that we have focused on have been on helping people generating better queries to find the right information that they need to look, the right evidence that they need to look at to create systematic reviews. And also AI technology that help with the appraisal, that is, with the assessment of the evidence they found to decide which one should be used on for the review and which one should be discarded because it's not relevant. And a third area I want to highlight, so I went from consumers to medical practitioner, and the third area I want to highlight is work we have done from a system perspective. And with this respect, you all would know that key to the effectiveness of artificial intelligence is the availability of data. It's the availability of a large amount of data. Now, some use cases also in health, and I would say particularly in health, however, are low resource use cases. They do not have a lot of data. Imagine you're trying to figure out the best treatment from rare diseases, or you're trying to identify patients that are eligible to clinical trial and for very specific trials. Now, in the ideal world, you would try to assemble a large amount of data by sharing data across different data providers, say different health authorities. However, data governance impedes to do that. So our goal has been to learn effective AI models on all the possible private data they can get access to, but without the need to share data. So by leveraging federated learning frameworks. And in this respect, we have been focusing on creating search engines, rankers, that are learned in a federated way and that can be used, for example, to empower better systems to identify patients to recruit in clinical trials by leveraging EMR data.